In 2017, long before formal funding, institutional partnership, or international recognition, members of the Slum and Rural Health Initiative, SHRIN, began engaging with people living in underserved communities and also internally displaced people living in migrant camps affected by conflict in northern Nigeria. We began with human connection because we believe in the power of a positive social contact.
Many of these young people in these IDP camps were willing to engage through games like football, ludo, storytelling, music, social interactions and conversations, rather than through the formal counseling systems that work in traditional system. These realization and eye-opening discussions became a defining philosophical turning point for the organization.
The team recognized that unresolved emotional distress, social exclusion, hopelessness, and lack of opportunity could expose vulnerable young people to exploitation, violence, instability, and radicalization. Mental health support therefore became linked not only to healthcare, but also to peace building.
Event took months and months of midnight work, writing. We got feedback from some funders. Some funders did not give us feedback, but eventually I cannot forget that day and that experience. This led to a breakthrough. We got a transformative funding from Grant Challenges Canada and our government-led partners that brought light to the onset for the Birth of the Bravest project.
In 2021, Slum and Rural Health Initiative formally launched the Brave Heart Project. One of the most groundbreaking developments during this year was the establishment of the Friendship Tent, described as the world's first solar-powered mental health center for displaced young persons.
The Friendship Tent also became increasingly recognized as a trusted mental health hub within the camps. The organization conducted evaluation and observed significant improvements in depression severity, anxiety outcomes, mental health literacy, trauma awareness, and psychosocial well-being among participants.
Teams from the World Health Organization and Nigeria's Federal Ministry of Health visited our IDP camps to observe the work of our community mental health therapists and evaluate the implementation of the Brave Heart model within humanitarian settings. One of the most innovative developments during this period was the launch of the 5G Remote Clinic project. Through collaborations with institutions including the University of Glasgow, displaced young people with severe mental health conditions gained access to remote consultations and specialized care support from experts in Nigeria, the United Kingdom, and other regions.
By 2026, SHRIN's focus has shifted strongly towards sustainability, community, and long-term system strengthening. Therapy delivery, psychosocial support activity, mental health education, and community-based intervention continue through the existing infrastructure built over these several years of implementation. The work began years earlier as small volunteer-led psychosocial activity inside displacement camp had evolved into a recognized humanitarian mental health movement, contributing to community resilience, system strengthening, youth empowerment, digital innovation, and global conversation around mental health care in fragile settings.